Good morning, everyone. We'll start today's briefing with Mayor John Cooper, followed by Dr. Alex Jahangir, Chair of the Metropolitan Board of Health and Metro Coronavirus Task Force. Joining us this morning is Dr. Buddy Creech, Associate Professor of Pediatric Infectious Diseases and Director of the Vanderbilt Vaccine Research Program. Also, Dr. Calvin Smith. He is the Assistant Dean of Admissions, Assistant Professor Internal Medicine, Associate Clerkship Director at Meharry Medical College. Also joining us today are Linda Chapani, President and CEO of Clinical Research Associates, Director Chief William Swan, President of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell from the Metro Public Health Department. They are here to help answer your questions. We'll now begin with Mayor John Cooper.
Good morning, Nashville. It's been 6 months since Nashville saw our first confirmed COVID-19 case, and we have been managing the curve ever since. Metro Public Health can report today continued steady progress in our COVID-19 response. 2 months ago, we were experiencing an average of 350 new cases per day. But for the first time in 3 months, our 14-day new average actually dipped below 100 this week. Now, we've had a slight uptick in the last several days, and Nashville's 14-day new case rolling average now sits at 112. But that's a long way from the peak of 400 in mid-July. Today, we're reporting 99 new cases. There are 1,052 confirmed active COVID-19 cases in Davidson County, but a long way from our high of almost 6,000. Transmission rates have ticked up to 0.92, but are still below our goal of 1. Together, we have made tremendous progress over the past 3 months, but we must remain vigilant. The past few days have seen a slight uptick in new cases, as well as the percent positive, and it will be a few more days of nervously waiting until we can assess the full impact of Labor Day weekend. Nashville is currently at 16.3 per 100,000 residents for our 7-day new case average. Now that's up slightly from 15.7 last Thursday, but this is better than the state of Tennessee's overall average of 18.3 cases per 100,000. Remember, our state and country's goal in this metric is 10. Nashville's current 7-day new case average of 16.3 shows excellent progress from an average of 28 1 month ago and just under 60 2 months ago. Davidson County has gone from number 1 worst in cases in Tennessee to 72nd. Our progress is due to wearing masks and our businesses maintaining disciplined public health practices. Dr. Jahangir will discuss these numbers in more detail. Now, in addition to our case count, another important count is the census. 2020 is a census year, and we need you to participate. The more Nashvillians who get counted, the more federal funding we will receive for our hospitals, schools, roads, and other important public services. Your census response is protected by law and will never be shared with law enforcement or immigration agencies. To learn more and respond, please visit 2020census.gov or call 844-330-2020. And remember, your response matters in shaping Nashville's future. Each resident counted is worth $10,000 to our schools and infrastructure over the next decade. If we all continue to wear masks and socially distance, our case numbers will continue to improve over time like they have over the past 3 months. We know that until we have a vaccine, masks and social distancing are our best weapons to fight the pandemic. Joining us today to talk about the status of vaccine research are Dr. Buddy Creech, Director of the Vanderbilt Vaccine Research Program, and Dr. Calvin Smith, Assistant Professor of Internal Medicine at Meharry Medical College. Dr. Creech and Dr. Smith, I want to thank you for being here today, and I'm looking forward to hearing you discuss the major vaccine trials happening right now in Nashville and how Nashvillians can sign up to participate in a COVID-19 vaccine trial. We are fortunate to have Meharry Vanderbilt and our public health department engage in the work of finding a vaccine for COVID-19. Remember, Nashville, don't share your air. Always wear a mask or other face coverings in public places. Keep 6 feet of distance between yourself and others. And visit covid19.nashville.gov to learn more about how you can avoid both getting and spreading COVID-19. I'll turn it over to Dr. Alex Jahangir, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning, Nashville. Here's some additional information on coronavirus in Nashville, Davidson County. First, I want to talk to you more about a couple of our key metrics. Last week, our transmission rate was the lowest since the beginning of this pandemic 6 months ago. Today, it is at 0.92. This is still within the satisfactory range. However, it is 0.16 higher than just last week. Today's 7-day average of new cases per 100,000 residents is at 16.3, 0.6 higher than last week. This metric needs to be below 10 to stay within the satisfactory range. Now, one contributing factor to this negative trend is the recent uptick in positive cases at our area correctional facilities. In fact, at least 269 of the 655 cases reported over the last 3 days holiday weekend were from either Tennessee Prison for Women, Riverbend Max, or the DeBerry Special Needs facilities. So nearly 40%. So we need to keep a close watch over the next few days to see if these numbers stabilize and start trending in the right direction. The doubling rate for the virus today is 155 days, meaning it will take that long for this virus to double in our city. A very great number compared to where we were in July. Keeping this number high is a good sign that our virus is slowing down from where we have been. Now, a reminder, if you have been in contact with someone with the virus or you have any worry about the virus, please feel free to go to one of our community assessment centers, which are open Monday through Friday from 7 a.m. to 1 p.m., or call our hotline at 862-7777. Again, 615-862-7777. The hotline is open 7 days a week from 7 a.m. to 7 p.m. Now, over the next few days, we could continue to see a rise in our cases. The Labor Day weekend, like past holidays, could generate new cases, as could area high schools opening up, local colleges opening up, and the state doing more testing at correctional facilities. These three factors may cause an increase in our cases. However, the biggest thing we need to still be concerned about is apathy. We've been battling this virus in our city for more than 6 months now. We're getting tired of it, and we're all ready to get back to the way things were in February or before. Now, this long journey began in March and looks to continue for the foreseeable future, and it could generate indifference and cause us to let our guard down. Please don't let that happen. Now, in May, 3/4 of the active cases in Tennessee were either in Shelby County or Davidson County. Today, only 15% of the active cases in Tennessee are in these two counties. In May, the urban and suburban areas of the state were trending worse than the rest of the state. Today, the exact opposite is true. Rural areas are seeing a faster spread of the virus compared to urban areas who have taken decisive and deliberative action. This means what we are doing as a community is working. The steps we have taken, the mask mandate, limiting gathering sites in public, and constant communication with the public have made an impact. Our numbers have improved and will continue to do so if we all continue to do what we are doing. So don't let up, Nashville. Stay focused and stay the course. I now would like to introduce Dr. Buddy Creech of Vanderbilt University.
Well, good morning. I'm Dr. Buddy Creech, and I direct the Vanderbilt Vaccine Research Program at Vanderbilt University Medical Center. I'd like to share just 3 brief updates regarding the work that's going on at Vanderbilt and in our Nashville community to evaluate new vaccines against COVID-19. First, Vanderbilt's played a critical role in vaccine sciences for over 50 years. Since the 1970s, Vanderbilt's been home to one of the National Institutes of Health-funded vaccine and treatment evaluation units. And these vaccine units are a critical part of the nation's infrastructure for the evaluation of new vaccines and therapeutics across the lifespan. So in addition to ongoing work that we have evaluating influenza vaccines, pertussis vaccines, and pneumonia vaccines, we're periodically called upon to address known or threatened pandemics, such as the 2009 swine influenza pandemic. So, since the novel coronavirus reached the U.S. in February, our efforts have been nearly exclusively on the evaluation of new antiviral drugs for COVID, such as remdesivir, and novel prevention strategies for COVID-19. Second, we're seeing early successes in vaccine development that are a result of new technologies and a commitment to focus our energies on vaccine development. For example, in March, our colleagues in Seattle and Atlanta launched a phase 1, first-in-human study of a novel coronavirus vaccine. And this vaccine candidate, in 2 doses, developed by Moderna, generated a robust immune response in volunteers, and phase 2 testing was similarly encouraging. Now, VUMC is one of several U.S. centers that are participating in the nationwide study of almost 30,000 individuals. And additional vaccine studies will be coming on board over the next few months as they see similar successes in their early phase studies. Many of these are going to enroll similar numbers of patients, 30 to 40,000 individuals each. They also involve vaccine candidates that really leverage new advances in molecular biology and genetic sequencing. And that's enabled us to develop these vaccines much more quickly than with traditional manufacturing ways. And because of that, we think about the primary goals of this study and the studies that come after, they will match what we've always done in vaccine development, namely, we will confirm that the safety profile seen in early phase studies is as expected, and will ensure that not only does the vaccine generate a robust immune response in the laboratory, but it also protects against severe disease or prevents disease altogether. Third, while we may not know when vaccines will be available for COVID, we do know what it takes to get there. First, we need to thoroughly evaluate vaccine safety during clinical trials. Our commitment has been, and it will always be, to first do no harm. Second, we need to evaluate the effectiveness of these vaccines rigorously, and that takes time. And third, we need to make every effort to ensure a diverse volunteer population in our studies. We want to make sure that when vaccines are publicly available, that each of us can look at the clinical trial participants and say that someone a lot like me participated in those trials, whether based on age, sex, race, ethnicity, or the presence of specific medical issues. For COVID-19 specifically, we want to ensure that groups that are often underrepresented in clinical trials, such as those in our Black and Hispanic communities, have ample opportunities to participate, particularly since these communities have been hit hard by the current pandemic. So as challenging as this pandemic has been, Vanderbilt, and as you will hear in just a second, Meharry and many others in the Nashville community are poised to lead through this crisis. We are truly grateful for those who've already volunteered for clinical trials and for those who will take part in the near future. We are truly in this together. So to that end, if you're interested in learning more about how you can participate and take part in these studies, I encourage you to visit us at vaccines@vanderbilt.com. And now it's my pleasure to introduce Dr. Calvin Smith from Meharry Medical College.
Good morning, and thank you for the introduction, Dr. Creech. Thank you to Mayor Cooper for the invitation to speak today, and thank you, Dr. Jahangir, for your leadership on the Coronavirus Task Force. As Dr. James Hildreth has mentioned on several different occasions, Meharry Medical College is participating in the federal government's Operation Warp Speed initiative with the goal of discovering and rolling out safe and effective COVID-19 vaccines and other countermeasures as quickly and as safely as possible. As part of Operation Warp Speed, Meharry is currently preparing to participate in clinical trials for COVID-19 vaccines created by Novavax and Sanofi. Due to the impact COVID-19 has had and continues to have on minority populations, it is extremely important that these trials reach a diverse population. It is absolutely vital that the research encompasses those diverse populations so that we can ensure that the vaccines, once FDA approved, are also able to help those often underserved and overlooked populations. Also, as a member of the Board of Health, I want to extend the Board of Health's gratitude and support to Dr. Caldwell and his leadership in proactively bringing about a partnership between Metro's Health Department and Clinical Research Associates, a leading clinical research facility here in Nashville. Clinical Research Associates, led by Linda Schapani, has been conducting clinical research in Nashville for over 30 years. Due to its reputation, it's been sought out by several pharmaceutical companies to participate in COVID-19 vaccine trials, and it is currently participating in trials with Pfizer and AstraZeneca. 3 of the doctors at the health department, Dr. Caldwell, Dr. Bailey, and Dr. Shaw Kai, will be providing physician services to CRA, giving them more insight into how these vaccines work. This is a great opportunity as the health department will be tasked with distributing the vaccines once FDA approved. This is also a cost-effective way for the health department to learn about the vaccines, as CRA will be reimbursing Metro for any and all associated costs with Metro's participation in these studies. We're so fortunate here in Nashville to have such robust clinical research with many facilities, professionals, and options for Nashvillians to learn more and to choose to volunteer for these important clinical vaccine research studies. Vanderbilt, Meharry, Clinical Research Associates, and Nashville's Public Health Department are all joined together to encourage anyone with even a slight interest in these trials to learn more. These trials are all competitive enrollment, meaning that cities across the country are seeking participants. Those cities who enroll participants the soonest are the ones able to continue with the research. Now more than ever, it is the time for all of us as citizens to come together to help us contain and control this virus. This is an opportunity for the medical community to come together in ways that are historically unprecedented and represent each and every segment of our population. As we've recently seen with the recent pause in AstraZeneca's trial, an abundance of care is being given to those trials, even in spite of the urgency to create an effective vaccine. We believe it is vitally important for Nashville, the healthcare capital of the U.S. and the capital of the volunteer state, to be represented in this truly important historical work. To learn more about these and other clinical trials, please visit www.asafenashville.org.
Thank you, Dr. Smith. We'll now begin taking media questions, starting with Julia Palazzo with Channel 2.
Thank you. A few questions. First for Mayor Cooper. The partial Broadway closure this weekend had a lot of people talking, even suggesting permanently closing the whole street on weekends indefinitely. Just wanted to get your thoughts on whether or not you've decided to do this again, and would you support a permanent closure on weekends moving forward? And also looking ahead to October, just wondering when a decision, if it's been made already, whether or not on Titans fans being hosted for games next month, and also your thoughts on Halloween celebrations and trick-or-treating in Nashville. And then just a quick question for Dr. Caldwell. Going into the first weekend of the NFL season, has the enforcement strategy changed to, control crowds, and especially on Monday for the first Titans game? Thank you.
Thank you, Julia.
Thank you, Julia. I'll go through a couple of your questions. Get us back to football, wear a mask. To get us back to football, wear a mask. We're all excited about that opportunity coming to Nashville. We need a safe environment for that to happen. For the road closures in downtown Broadway, TDOT has approved the closure again this Friday and Saturday through the end of September. This is a pilot project. We're trying to decluster crowds. Labor Day is always a concern, as was the 4th of July and Memorial Day. We want to get safely through that. All this will be done in consultation with neighbors and our partners in Broadway to have a extremely safe space for people to come to Nashville for. Again, I think all of us want to look and examine to see if it was effective before we continue it. But again, it's part of our working the problem. And again, your question about football and road closure. I'm sorry, Brian. There's Julia, help me with the
Halloween.
Oh, Halloween. Well, hey, most spooks in my neighborhood, most people in costumes are wearing masks, so I think we'll just have to address that problem when we get to it. And I hope the disease rate is so low by that time that we are able to have a Hollywood practice. There's no reason you could not do social distancing and have Halloween. It'll be parents working together and to do it carefully. This is a perfect example of work the problem. See how we can get it done in a way that is safe and have a normal life in Nashville and get us back to normal.
Good morning. Our enforcement strategy continues to evolve, as you saw this past weekend with the crowds on Saturday and that we made the change on Sunday. It seems to have been quite successful with the attempt to allow the sidewalks to be for walking and waiting to get into the restaurants and bars. The lines would start at the curb and then go and extend out to the middle or beyond the street. Similarly, anytime we are going to be faced with expansive crowds, increasing numbers of people, we're going to evolve our enforcement efforts. Over the last few weeks, you've seen that Mayor Cooper and the leadership of all of the Metro Enforcement Task Force members have built an infrastructure as well as a process for us to manage better than we ever have before to quickly identify either before events happen or as events are happening so that we can intervene to assure that all the best safety protocols are being put in place.
Our next question is from Nancy Amons with Channel 4. Good morning, Nancy.
Morning, Brian. I have two questions, please. One is either for Dr. Smith or Dr. Creech. Are you afraid that the suspected adverse reaction in one of the trials is going to discourage volunteers? The other question is for the mayor, on behalf of a transportation vendor who's asking, why can bars safely have up to 25 people and they're indoors, but transportation can only have a maximum of 10 and they are outdoors? Thank you.
Thank you, Nancy.
It's a great question as we think about how we handle adverse events in clinical trials. The first thing I would say is that we plan for them. We plan for mild adverse events that might happen after vaccination. We think about those events that might happen weeks to months after vaccination. And in each one of these protocols, we create safeguards so that if we see the same types of events over and over again, if we see events that are particularly severe or unusual, we have mechanisms to pause or even halt studies until independent groups of very good scientists and physicians can get together and make a determination about whether it's safe to move forward. I think all of us would say that clinical trials are foundationally built on trust. And as I talk to volunteers who are interested in clinical trials, it's the first thing we talk about. We talk about what we're going to do to make sure that we do not put individuals at undue risk. With that being said, these trials are new. There are things we do not yet know about them. And this is why it's so very important that those who are healthy, those who have underlying risk conditions, those from a variety of diverse backgrounds participate in these trials, knowing full well that the safety comes first. And anytime there is even a small safety signal, those are being evaluated and adjudicated in real time so that the remainder of that population remains safe as well.
Thank you, Nancy, for that question. I think the answer is in size. In transportation, often a lot of people are crammed into very few square feet. And we are always, I know the health department is always willing to work with any business in the county on what is an effective social distancing strategy for that business. But overall, if you've just got a ton of people in very few square feet, you do have to be cautious. Then that's why we've hitched a lot of these openings to the size of the space and the capacity and it all comes down to your ability to effectively social distance. I do appreciate with transportation them limiting their group to a cluster that has a natural social connection with each other so that you're not cross-spreading it between groups. I think that's extremely important. I would encourage them to reach out to the public health department and talk about, is that number of 10 fixed based on the size of square footage that's in the vehicle? Sure, we can look at that. But by and large, you're looking at a truck bed that's pretty small. These, you're not probably getting away with comfortable social distancing right now. And that's where the state of play sort of is with that. But thank you for the question.
Our next question is from Brett Kelman with the Tennessean. Go ahead, Brett.
Hi, good morning, everyone. So Dr. Creech and Dr. Smith have talked a little bit about vaccine trials in general and sort of the implications of the halt of the AstraZeneca trial. I was hoping that Ms. Shapani could talk a little bit about what functionally happened at Clinical Research Associates when that trial stopped, and sort of where they were in doing their research and how it halted and what happens next.
Thank you, Brett. Linda.
Thank you for the question. We really were supposed to get started this Monday with enrollment, and we did receive a call on Sunday afternoon that the study had been placed on pause. So we have not started yet. We are enrolling in our Pfizer study currently, but AstraZeneca, we are on pause.
Thank you. Our next question is from Harriet Wallace from Fox 17. Go ahead, Harriet.
Yes, good morning, everyone. My question is regarding the potential return of metro schools. From our health department, I just wanted to know, I've heard from some teachers, and there are some concerns that students may not be able to properly socially distance because of the large populations in the schools. From a safety health perspective, how are you all advising metro schools on doing that effectively? And what do you say to the parents who are worried about their children returning to school and then may not be able to be as safe as they would hope? Thank you.
Thank you, Harriet. Dr. Jahangir will answer that.
Thank you, Harriet, for such an important question. As I mentioned before, in April or so, the mayor brought together a group of leaders from different school systems, private, public, parochial, charter, as well as I and several other people from public health and other extras from Meharry and Vanderbilt to advise kind of a basic framework around schools. We've written that report. It's public, the roadmap to reopen schools. And as we roll into a modified phase 2, each school has been given the freedom of taking that report and working with their own experts to find out the best way to reopen schools. And I think you've seen some of the some smaller schools have opened up with certain restrictions. Dr. Battle and her team have come up with a plan for Metro Public Schools. So I really would let each parent look at wherever the school is and look at the plan for the students. See if it makes sense given your family situation, and by that I mean your child's health, the health of those in your household, perhaps of this extended family that your child may interact with, and make a decision that fits best for you and your family. But again, how a school approaches this is really based on how on the school and the advice they're getting from their experts. And so I would defer you to each school system that you want to answer that specific question. Thank you.
Harriet, if I may, because I think this is so important for parents and everyone in Davidson County, MMPS is conducting a poll right now, as it should be, to reach out to parents. Because parents are always going to have the choice of keeping their children at home during a pandemic. But MMPS needs to know how many parents prefer the classroom option as they're making the decisions on reopening. Each school system in Nashville is responsible with their parents and their staff for making these choices. So again, encourage parents to fill out that questionnaire being distributed by MMPS and think about it, and that's going to be a valuable tool in informing their choices going forward.
Our last question today comes from Yi-Yoon Jong from the Tennessean. Good morning.
Good morning. A question for Mayor Cooper. Metro Council is considering legislation that would extend enforcement authority of health orders to all Metro employees. What specific plans do you and the COVID task force have in regards to which department or employees will be a part of enforcement and what area of enforcement they'll be working on? Lastly, what type of training will be given to these employees? Thank you.
Thank you.
Thank you, Yehan. First, I want to thank the Metro employees who've been working so hard at enforcement. We've shown progress because we are getting people to wear masks, and you can see it in the numbers. Part of this enforcement action or authority is directed at Metro employees who are already enforcing things. So if you are enforcing one thing, you have the right to ask people to wear a mask and help enforce for public health. It's really just a common sense efficiency to extend that. Secondly, our public health police, everybody is pretty, if you've seen the numbers, they're busy on weekends, and we need to supplement and augment that help from people who are already out there doing enforcement practices from the city. So it's a natural extension. It's a pretty common sense efficiency. People don't realize how in the lane that people are. And in terms of training and getting this done right, I'll rely on public health and to help teach what we have already learned. And so much of this is to be focused on effective enforcement, to have the practices that allow us to get back to normal, to get back to as normal economy as possible, as safely as possible. And the reality is it enforcement or is it education? You get a little bit more attention if people know you have the ability to enforce, but the goal is education. We all want the same thing. We can work together to do it. Let's use all of our Metro resources that are in the field working right now to help public health get this super hard job done. And again, it's just a simple, basic government efficiency. But let's take a moment and look at the progress that we've made with the help of enforcement, frankly, also. To go from worst to 72nd is a huge achievement. To have the battleground shift from cities where everything is against you. We have prisons in our population. We have nursing homes. We have clusters. We have density. The environment where the disease should have spread the most and be the worst should be in these cities. And right now, we're really a model for the state and have led the state into an improved condition, but a dramatically improved condition in Nashville and in these cities. So we should be thanking the people doing education and enforcement, right? To remind us all as citizens to do our duty, to do our job. And we can all use a little reminding from time to time, and we're trying to do it in the nicest possible way because we're Nashville.
Those are all the questions we have this morning. I'd like to thank Dr. Buddy Creech, Dr. Calvin Smith for joining us today. As always, we're grateful for Amy Linkite and our partners at the Bridges for the Deaf and Hard of Hearing for providing the ASL translation at these press briefings. The next Metro COVID-19 press briefing will air on Thursday, September 17th at 9:30 a.m. Thank you for joining us. This concludes the briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.